Hi friends, so we are back with another video on radiology for surgeons, and in this video we will talk about some special investigations. So we have talked about the basic principles of radiology. We've talked about how to safely use X-rays and radiations. Uh, then we talked about plain X-rays, then contrast X-rays, and in that same sequence, now we will be talking about some special investigation today. Again, we'll be talking more about the basics, and then we'll leave it on you to practice and get more in habit of seeing the investigations and then interpreting them. So the first investigation we are going to talk about is a mammogram. Now, we know in surgery, because of the high rise of carcinoma breast, uh, we do a lot of mammograms. And so we need to understand what mammogram is so that we are able to analyze it properly. So now, principle-wise, mammogram is nothing but an specialized high resolution X-ray of the breast tissue. Okay. So all that principles which we taught, which we learned in X-rays, the same principle works here. So we'll grade various tissue and the parts of the tissue based on the radio density. Now, radio density, it will be something will be radio opaque, which is hard. Something will be soft or less soft, and accordingly they will be less, more black, and less of white and white. So this is what main principles is. And then when we add the information and knowledge about pathology, we'll be able to find out what is the disease in question. So there's in the same way as we showed in the X-ray, on one side there's the X-ray tube, and in the between you have two plates. One plate is called the cassette plate, or where the film is placed, this one. And then there's a compression plate, which compresses the breast tissue between the two plates. And then an X-ray is taken. Okay, and there are various views which we will be talking about. So this is how an X-ray is done. And you can imagine the projection, how, so basically in this, only the breast tissue comes in the X-rays. And the X-ray is little high resolution. So most of the tissue, like for example, in the simple X-ray, will not be able to see fat tissue or vascular tissue. But in this mammogram, because it's a digital and high resolution, we are able to see a lot of soft tissue also. So this is, let's say, one such mammogram. Now, the first thing I want to focus on is the views. Okay, so there are two views which are done for screening mainly, which is the mediolateral and craniocaudal. Okay, mediolateral oblique and craniocaudal. Okay, so for example, if this is a person, and let's say of this person, there's a breast tissue on this side. Now, craniocaudal means the beam is falling from the cranial end to the caudal end. Okay. Now, and then obviously you get a two-dimensional image of this breast tissue like this. Okay. So it is like, for example, it is as if we are seeing the breast tissue from the top. If I'm seeing for the top, I divide it into two parts. This will be, one part will be medial, this will be medial, and this will be lateral. So whenever we are seeing a craniocaudal image, it divides the breast into medial and lateral part. Okay. And the second view, so this is the craniocaudal view. The second view is mediolateral oblique. Okay. So from medial side to lateral side oblique. So this axis is called mediolateral oblique. So this also, and this is the breast tissue. So this also gets an image, a two-dimensional image of breast. But now, because we're seeing from a side towards this, it divides the breast into the top and the bottom. Okay. So there's a cranial, this also divides in like this. So one part is so like this. This is part is the upper, this part is the lower part. So this is how the breast tissues will appear. Now come back to this image. Now this is a craniocaudal image. Okay. So means we are seeing the breast from top. Now see, as if you're standing on the head end of the patient, and then you're looking down on the breast tissue. Okay. By convention, wherever this marker is placed is on the outside of the breast. Okay. So if I'm seeing from the top, uh, so this is the outer side or the lateral side, and this is the medial side. Okay. So if I divided the breast into two half by a line joining running across the nipple, uh, this part is lateral half, and this part is the medial half. Okay. This is one thing which we need to remember. So in this case, I know that the lump which is there, which I'm able to see lump here, it is on the lateral half of the breast. Now come to the medial lateral oblique part. Medial lateral oblique part is slightly easy to understand. Now you are seeing the breast from a side, okay, from medial side to lateral side. So again, we draw a line passing through the nipple. Now, one side is up because we are seeing from the side. So one side is up and one half is the lower part. And obviously, we can see the pectoral major muscle here. So obviously, the side which is towards the pectoral major is the top side or the upper part. So this is the upper and this is lower part. Now, if you combine both the images together, and that is why all the 4 images have to be seen in one go whenever you are analyzing mammograms. So here we have something which is there in the lateral part, lateral half, and which is in the right behind the thing. So it's like in the central part. Okay. So if upper and down is like the middle part, and so it is somewhere in the maybe 9 o'clock position if it is the left breast. So this is how we will analyze this lump. So if I have to draw the breast cross-section image here, so somewhere here will be the lump. Okay, this is the lateral side, this is the medial side, this is the upper side, this is the lower side. So this will be the position of the lump. Just by seeing these 2 images, we are able to ascertain where the pathology is, so that we can then we can do ultrasound, we can do a biopsy from there by knowing these positions. Okay, so that's the first thing we need to understand about what views we do and how we analyze the various positions of. Okay, now let's say, just for sake of it, we see this shadow which is appearing, which is also appearing here. Okay, so now I know this is on the lateral side, lateral half, and this is also on the upper half. So means this shadow somewhere will be in the upper outer quadrant of the right breast. So this is how we use this information of the views. So these are the 2 views which are done for screening. And then for further, there are 2 more views which are done to see a lesion in detail, which are called spot compression